pretty tall for Ruth.
Okay, Stormy.
Thanks, Stormy.
Thanks. In the U.S., more than 300,000 babies are born prematurely every year. The cost of treating them can be staggering. In the first of her two-part special assignment, medical reporter Sherry Sellers says a new device could change that.
All right, you can just take a quick look at her. We're going to put her...
A healthy full-term baby. That's how most pregnancies end up. But nearly 1 out of every 10 babies arrives 3 or more weeks before they should. They're premature. Modern treatments and technologies are saving more and more of these babies once they're born, but at a tremendous cost, as much as $1,500 a day. No dollar figure can be put on the emotional strain parents go through as they watch their babies struggle to survive. But now there may be hope for preventing these early births. It's called the Term Guard Home Monitoring System. It's a lightweight belt that's strapped around the mother's abdomen. A sensor on the belt picks up even the smallest movements or changes in pressure from the uterus.
It detects a lot of contractions that patients don't really understand that they're having. They don't often feel the contractions, which we think are sometimes the forerunners of patients who are about to go into preterm labor that is very obvious.
The belt is worn for 2 hours each day. A small recording unit comes with it and is used to store the information. Then once each day, the patient transmits the stored information over the phone to a monitoring center where it's printed out. Contractions usually appear as a bell shape. If more than 3 contractions per hour are recorded, a nurse at the monitoring station alerts the patient's doctor, who may want to prescribe bed rest or medication to help prevent the labor from progressing to an early delivery. Tomorrow, a visit with a woman who hopes Term Guard will prevent her from delivering her twins early. On special assignment, Sherry Sellers, 9 News.
Okay. Thanks, Stormy.
Thanks, Stormy. A new monitoring system called Term Guard is offering hope that some premature births can be prevented. In part 2 of her special assignment, medical reporter Sherry Sellers introduces us to a woman who hopes Term Guard will help her.
Bonnie Zeller is expecting twins in about 6 weeks. She's already begun having preterm labor contractions. That makes her a good candidate for the Term Guard monitor. It allows Bonnie's doctor to monitor the frequency of her contractions without putting her in the hospital. It also gives Bonnie peace of mind.
It gives me a sense of security, I think. As soon as I learned I was having twins and that it was a high-risk pregnancy, I became really concerned about it. What can I do to prevent the babies from being unhealthy?
Bonnie is one of about 30 patients who've been monitored in the metro area. Across the country, more than 3,500 women have used Term Guard since its introduction just over a year ago.
The scientific community is not 100% sold on it, and the expense is significant. And we're talking $75 a day is not cheap, but at this point in time, if you're talking about taking care of a preterm baby, it's somewhere between $1,200 and $1,500 a day. We definitely can go ahead and pay it off many, many, many fold.
Early studies show that women who've used the Term Guard deliver their babies an average of 8 weeks later than they would have without monitoring. That's long enough to give most babies a chance at a normal start in life. How do you know if you're a candidate for the monitor?
By far, the 3 leading indicators of the patients that are put on our service are previous preterm delivery, preterm labor this pregnancy, and multiple gestations.
Women who are pregnant should be familiar with the symptoms of early labor. They include contractions, frequently painless but with a regular pattern, menstrual-like cramps, lower backache that is rhythmic or constant but not relieved by a change of position, intestinal cramps or diarrhea, and a change in vaginal discharge. Some of these things can occur normally in pregnancy, but if you have any doubts or just don't feel things are right, you should talk to your doctor. On special assignment, Sherry Sellers, 9 News.
Our lawn and garden expert John Cruddy is up next.